So there's a massive expansion in interest in immunotherapy. I mean, I'm an allografter by training, so I've always believed in the immune approach to an allograft in myeloma, albeit it was relatively weak. And I could never have imagined we would find ourselves here in the 2020s talking about numerous immunotherapy agents driving the patient's own immune system to attack myeloma. So it's a very, very exciting period. And most of these agents are starting in the triple class refractory space, the advanced disease. But ultimately, and my lab in particular has got data that shows that the immune profiling changes dramatically from diagnosis to the end stage. Therefore, it makes sense to bring those therapies into the earlier lines of treatment. And at present, those studies are being done. So let's think beyond that. What if these studies prove that that's a better space to use immunotherapies? In that setting, then I think we then need to think about what do we do post-immunotherapies? Do we do more immunotherapies? And those studies are being thought about and designed. Or do we see basically a paradigm shift? A lot of the drugs and strategies we use in first and second line then become the standard of care in third and fourth line. All these things are possibilities. One thing is that we probably are not going to get away with sequential immunotherapies because particularly T-cell engagers, because one of their limitations is they exhaust the T-cell pool. So it makes no sense. You might change the target to get round antigenic escape, but if the T-cells are tired, they're still going to be tired. So there may well be ways of leapfrogging lines of treatment using non-immunotherapies, and that's where the current strategies we use may come into play, or the development of more targeted non-immunotherapy approaches that are in development that will come into clinical trials in due course. So I think we will see a landscape where first line will be immunotherapies, second line will be non-immunotherapies, third line immunotherapies, and so on. That's what I would predict for the coming future.